इसमें ये है कि देखिए प्रोसीजर तो आप बेशक करते हैं, लेकिन ये है कि आपको स्कूल की पेंटिंग और इसकी वॉशिंग का भी आपको बताना चाहिए ताकि आप अपने जो टैक्स वगैरह आप इनको डिवाइड कर सकें किस तरीके से इसकी प्रॉपर यही है कि आप इसको वहाँ से निकालें। सबसे पहले ये है कि आप एयर और वाटर, एयर पे आप और वाटर जो इसका जो सक्शन वाला चैनल है आप दोनों के ऊपर जो विंडा रखिए एक ही वक्त पर विंडा रखिए ताकि इसमें से एयर भी आए और सक्शन भी आए। ठीक है, अगर ये दोनों आपके प्रॉपर काम करें तो आप ये समझिएगा कि आपके स्कोप जो है वो बिल्कुल सही हालत के अंदर है, इसमें किसी भी किस्म की कोई प्रॉब्लम नहीं है। ठीक है, ये आप देखिए ये सक्शन है, सक्शन वाले को फुल प्रेस करके रखिएगा और एयर पे आपकी फिंगर होनी चाहिए। अगर एयर भी देगा और सक्शन भी प्रॉपर तरीके से कर रहा है तो ये समझे कि आपका स्कोप जो बिल्कुल लीकेज नहीं, बिल्कुल प्रॉपर जो वर्किंग के अंदर है उसमें जो दोनों चैनल्स जो एक ही वक्त में जो काम कर रहे हैं। और अगर इसमें एयर दे रहा है और सक्शन नहीं कर रहा है या सक्शन कर रहा है एयर नहीं दे रहा है तो इसका मतलब ये है कि आपके स्कोप के अंदर प्रॉब्लम है। तो जब भी आप जी
ये हमें जो सिखाया गया था वो ये था कि उससे ख़त्म करें पहले एयर और वाटर ताकि अगर कोई कुछ फंस हुआ है वो बाहर आ जाए।
मैं वही चीज़ आपको
एक साथ और दो इकट्ठे कैर नहीं करना
नहीं, लेकिन ये है कि
हमें ये सिखाया गया कि आप पहले एयर और वाटर से करते हैं कुछ अगर फंस हुआ है वो निकल आएगा।
आफ्टर द प्रोसीजर वही मैं आपको कह रहा हूँ, वही आपको चीज़ समझाना चाह रहा था कि उससे ये होगा कि जो एयर अगर निकल जाए उसके अंदर किसी भी किस्म का कोई स्लाइवा है ये सक्शन, लेकिन हमें जो बताया गया दोनों ही
सही बना की उम्र
उसके बाद ये कि आप इसके बटन्स वगैरह ठीक है उसको साइड पर किसी डिटर्जेंट के अंदर आप बता सकते हैं ताकि इसके अंदर से किसी भी किस्म का ठीक है। उसके बाद ये है कि एक्चुअली चैनल के लिए या कोई जनरेटर के लिए ये आप इसके हाँ तो इसके अंदर आप इसको फिक्स कीजिए और आप जो है यहाँ से सील देखिए और आप इससे ये होगा कि वो प्रॉपर तरीके से आप इसको करते रहेंगे। हाँ अगर आप ला भी नहीं रहे तो मैं आपको बता रहा हूँ, लेकिन ये बहुत ही आपको जो है दोनों तरफ फ्रेश करना चाहिए। अभी मैंने जो अपनी डायरेक्शन जो फ्रेश की रखी है वो इस तरीके से ठीक है जी हाँ, तो ये जो है इस चैनल से इसके ठीक है इस तरह से अब आप इस फ्रेश की डायरेक्शन जो है जब आप अगर प्रॉपर तरीके से ये चीज़ सीखेंगे तो आप पेशेंट्स को या असिस्टेंट्स को भी जो ये बता सकते हैं। अब ये कि आप प्रॉपर तरीके से इसके साथ साफ किए, लेकिन ये है कि एयर वाटर के अंदर आप ब्रश नहीं लगाएंगे, ठीक है। जब इस चैनल के अंदर आप ब्रश इसमें नहीं लगाइएगा, इसलिए कि ये जो है इसका रास्ता जो है उसमें ताकि इसके प्रॉपर तरीके से हर जगह से तो आसानी से नहीं, इस तरीके से आप नहीं कर सकते हैं, क्योंकि इस तरीके से ये है कि आप अपने तो इसका अगर इजीली ये आपका ब्रश इसमें काम कर रहा है तो आप जो है इसको ब्रश को जो है इसमें आप डाल सकते हैं। और अगर कहीं पर भी आपको रेजिस्टेंस फील हो रही है, कहीं आपको फोर्स अप्लाई करना पड़ रहा है, तो आप फोर्स प्लीज़ नॉट अप्लाई कीजिए, बल्कि वो आप कंपनी वाले को आप ज़रूर लीजिए ताकि वो इसको प्रॉपर तरीके से क्लीन करें, क्योंकि ये है कि इससे आपके चैनल में उसमें लीकेज आती है, वो आपको बहुत ज़्यादा प्रेशर अगर बहुत ज़्यादा हो तो आप उसके अंदर ज़बरदस्ती उसमें प्रेशर लगाएंगे, ठीक है। उसके बाद आपका डॉक्टर भी इसके साथ अटैच दोबारा से मैं बता दूँ, इसमें थोड़ा सा प्रेशर देंगे, फिर आप इसके बाद ये आप इसमें वॉशिंग ट्यूब्स हैं वो भी आप इसके साथ कनेक्टर है ये वाटर का, जो आप इसके साथ इसके कैप को जो अटैच कर सकते हैं, ठीक है। ये हमारी जो प्रॉपर है जो है इसके साथ कनेक्टिंग ट्यूब्स जो है उसके साथ फिक्स कर दी गई हैं। आप एक टब लीजिएगा, टब जो है ऐसा हो कि उसके अंदर बिल्कुल स्कोप को जो है मोड़ना नहीं है, बल्कि ऐसा हो कि आराम से फ्लैक्स हो के उसके अंदर जो है फिक्स हो जाए, ठीक है। और जितना ज़्यादा आपके पास बड़ा टब होगा उतना उसके लिए ज़्यादा अच्छा है, ताकि इसके फाइबर्स वगैरह ब्रोकन ना हो। ये सारे चैनल्स वगैरह आपके पास जो इसके ब्रशेस वगैरह होने चाहिए, ये टिप ब्रश भी होना चाहिए, ताकि आप अच्छे तरीके से जो है इसके चैनल्स को जो है आप क्लीन कर सकें, ठीक है, यहाँ से। और लेकिन एक चीज़ का आप ख्याल रखिएगा कि ये इसका सामने जो लेंस है आप इसको रोटेट नहीं करेंगे और ना इसको ज़बरदस्ती इसके ऊपर जो है आप प्रेशर देंगे, इतना आप स्पेस रखिए कि लेंस आपका जो है इसके ऊपर ना आए, ठीक है। और बहुत ही जेंटली हाथ से आप इसको जो है वो करें। ये आपको फ्रंट व्यूअर के लिए बता रहा हूँ और साइड व्यूअर के लिए भी, गैस्ट्रोकोलन के लिए भी और ERCP स्कोप्स के लिए भी जो है लेंस के ऊपर नहीं आए, ताकि ऐसा ना हो कि उसके ऊपर कोई स्क्रैच वगैरह आ जाए तो आपका स्कोप जो है वो फिर बेकार हो जाएगा। बाकी ये है कि आप ये जब ट्यूबिंग वगैरह आप इसके साथ फिक्स कर दें तो उसके बाद जो है
इसको पानी में डिप करें,
आप पानी के अंदर इसको डिप करें। और ये हमारे जो सक्शन पॉट्स हैं इसके अंदर एक जो है सक्शन में से आएगी और एक एयर वाटर को क्लीन करने के लिए जो है आप इसी में से जो है एस्प्रेट कर सकते हैं और इसी में से आप जो है इसको जो है प्रेशर के साथ जो है क्लीन अपने चैनल्स को जो कर सकते हैं, ठीक है। ये आप देखिएगा यहाँ से, ये आप होल्ड करके रखिएगा इस तरीके से, ताकि ये कैमरे के सामने और आप सबको भी जो नज़र आए कि ये पॉट जो है ये एयर वाटर के लिए, ठीक है। ये देख रहे हैं इसमें से जो है ये एयर वाटर चैनल में से जो आ रहा है, इसको जो है ये हमारे एयर वाटर चैनल को जो क्लीन कर रहे हैं। और उसके बाद जो है आप दूसरी पॉट के साथ अटैच करके आप उसको जो है सिरिंज को फिल कीजिए। अब आप देखिएगा कि ये हमारा जो है सक्शन चैनल से जो है ये पानी जो है इसको जो फ्लैश करेगा, ठीक है। नहीं, भले इसके अंदर ही फिक्स रहे, ठीक है, क्योंकि ये तो जब तक कि आप मुतमईन ना हो जाएं कि आपकी प्रॉपर तरीके से क्लीनिंग हुई है या नहीं, जब तक आप इसको जो है इसी तरीके से जो है फ्लैश करेंगे, ठीक है। ये हमारा जो है सक्शन चैनल में से जो है ये वाटर जो आ गया, ठीक है। तो जब ये आप फ्लैश कर चुके हैं तो आप इन्हीं ट्यूब्स के साथ, लेकिन एक चीज़ का आप ख्याल रखिएगा कि जो आपका टैक्स या आप जो ये इस चीज़ को ना भूलने पाएँ कि आप इसका जो है सेफ्टी कैप या ईटीओ कैप जो है ज़रूर अटैच कीजिएगा, ताकि इसके अंदर किसी भी किस्म का कोई पानी के कोई ड्रॉप वगैरह ना जाए। टब का आपको मैंने ये बताया है कि इसका टब का साइज़ जो है थोड़ा बड़ा होना चाहिए, ताकि आप अपने स्कोप को जो ईज़िली जो है उसके अंदर जो आप इमर्ज कर सकें, ठीक है। ये ट्यूबिंग के साथ ही आप जैसे मैंने अभी फ्लैश करके आपको वाटर के साथ किया है, इसी तरीके से आप साइड एक्स भी इसके अंदर करेंगे, या जो भी आप उसके अंदर केमिकल जो यूज़ कर सकते हैं। जी हाँ, इससे ये आपका स्कोप जो बिल्कुल सेफ़ है और आप जो है इजीली उसको जो है स्टरलाइज कर सकते हैं। नथिंग जी, ये कोई भी ऐसा ये इंटरनेशनल मतलब क्लीनिंग का प्रोसेस है जो आपको मतलब बताया जा रहा है।
पोर्शन अगर टब में पड़ा रहे तो इससे
नहीं जी, कोई भी ऐसा इस पे अगर आपका ये कैप बिल्कुल सही है, अगर ये लूज़ होगा तो डेफिनेट इसके अंदर वो पानी वानी या केमिकल जो जा सकता है, लेकिन अगर आपने इसको प्रॉपर तरीके से फिक्स किया, आप मुतमईन हैं, तो आप उसके बाद जो उसके अंदर जो है अपने केमिकल के अंदर जो इसको डाल सकते हैं। 10 to 15 मिनट्स इसकी टाइमिंग है कि आप 10 से 15 मिनट जो है ज़रूर दीजिए। अगर आप अपने टैक्स के पास जो है जहाँ पे डिसइंफेक्टर आपके पास मौजूद हैं, हमारे पास तो एक्चुअली डिसइंफेक्टर मशीनें मौजूद हैं जिसके अंदर एक ही वक्त के अंदर 2 स्कोप अटैच हो जाते हैं। जी बिल्कुल, लेकिन ये कि जहाँ पे ये चीज़ें अवेलेबल नहीं हैं जी, उसके साथ सारी ट्यूब्स वगैरह जो फिक्स होती हैं, ठीक है। और अगर आपके पास अवेलेबल नहीं है तो मैनुअली मैंने आपको बता दिया है कि आप 15 मिनट उसको दें और आप अपने स्कोप को जो है डिकंटेमिनेट कर सकते हैं इसमें जो है, ताकि प्रॉपर तरीके से स्टरलाइज हो। लेकिन आप प्लीज़ जल्दबाजी मत कीजिएगा किसी भी किस्म के। अगर आपके पास स्कोप्स नहीं हैं तो आप अपने हिसाब से नंबर ऑफ़ केसेस रखिए, ताकि आप प्रॉपर तरीके से अपने पेशेंट को जो है केयर कर सकें उनकी जो है। ये ना हो कि वो आपका स्कोप जो है बजाय इसके कुछ डायग्नोस देने के बजाय कुछ और भी जो दे दें, ठीक है। या आप इस चीज़ का ज़रूर ख्याल रखिए। 15 मिनट्स जो है जी, फिर अगर आप ज़्यादा रखना चाह रहे हैं तो जैसे आप हेपेटाइटिस के पेशेंट्स हैं तो आप उसमें जो है 20-25 मिनट्स, या आप अगर आपके पास टाइम है और आपने एक लिमिट के अंदर प्रोसीजर रखें तो आप 30 मिनट्स जो दे सकते हैं, 25 से 30 मिनट जो आप उसको रख सकते हैं। तो इसे अगर कभी भी आपको कोई शक हो तो आप जो उसके साइटोलॉजी वगैरह या कोई भी कल्चर वगैरह जो आप उसका जो करवा सकते हैं, आप मुतमईन होंगे कि आपकी क्लीन।
ये जो डिसइंफेक्शन सोल्यूशन आप यूज़ करते हैं
जी,
ये मतलब अगर कोई नॉन एचजीएससी या ऐसे ही का पेशेंट आ जाए तो उसके बाद तो आप वो डिस्कार्ड कर देते हैं ना?
बिल्कुल आप डिस्कार्ड कर सकते हैं अगर एचआईवी का है, लेकिन सी पॉजिटिव के अंदर तो में अगर आप उसकी टाइमिंग बढ़ा देते हैं
तो आप कितने दिन आप ये सुबह आपने सोल्यूशन बनाया ना डिसइंफेक्शन के लिए, वो आप कब चेंज करते हैं?
एक्चुअली हमारे पास देखें डिपेंड टू नंबर ऑफ़ केसेस जो है, एक्चुअली इनका जो टाइमिंग जो 14 डेज़ की होती है, लेकिन ये है कि अगर आपके नंबर ऑफ़ केसेस ज़्यादा हैं और आपके पास बहुत ज़्यादा कोई इन्फेक्टेड पेशेंट्स आ रहे हैं तो आप उसके टाइमिंग जो है 1 वीक की भी कर सकते हैं और ट्वाइस अ वीक भी आप कर सकते हैं।
जो मैंने इनको बुलाया इन्होंने रिकमेंडेशन ये दी थी कि भाई अगर डॉक्टर साहब कोई इन्फेक्टेड पेशेंट आ जाए एचजीएससी सही हुआ तो आपने उस पेशेंट के बाद डिसइंफेक्शन के बाद उस सोल्यूशन को डिस्कार्ड करना है, ठीक है। उसमें मतलब ठीक है इसकी 14 डेज वो है वायबिलिटी एंटीवायरल मतलब वायरसाइडल या जर्मिसाइडल, लेकिन उस इन्फेक्टेड केस के बाद क्योंकि वो बड़ा हैवीली लोडेड होता है तो
उनके पास अगर आप देखते हैं तो नंबर ऑफ़ केसेस बहुत ज़्यादा होते हैं, ठीक है। तो वो अगर डिस्कार्ड कर भी देते हैं तो नॉट एट ऑल, क्योंकि मतलब कोई मसला नहीं है। लेकिन ये है कि जब आप इसका लिटरेचर वगैरह पढ़ते हैं तो HIV का भी और Hep B का Hep C का भी जो स्पोर्ट्स को जो ख़त्म कर देता है साइड इफेक्ट्स जो है, तो ये ज़रूरी नहीं है, अगर आप अफोर्ड कर सकते हैं तो आप उसको जो है डिस्कार्ड कर दें, वरना ये है कि आप उसको उस लिमिट के अंदर जो है, अगर 14 डेज़ नहीं तो कम से कम आप एक हफ़्ते के बाद ज़रूर उसको चेंज कीजिए।
कैसे करते हैं आप?
ये एक्चुअली रेडी होता है, इसके अंदर एक पाउडर फॉर्म के अंदर आता है, छोटी वाली आती है जी, बिल्कुल जो है
उसमें आप कितना पानी कितना डालें?
देखिए जी, दोनों
नहीं वो जो दो
ये दोनों, एक एयर वाटर के लिए, एक सक्शन चैनल के लिए, बिल्कुल दोनों के अंदर पहले जो पानी और उसके बाद जब आप जो भी आपके पास अवेलेबल सोल्यूशन है आप उसके अंदर जो है उसको आप फ्लैश करेंगे दोनों के अंदर जो है, ठीक है। कुछ और
मैं सॉल्यूशन का बात कर रहा था, आप कितना डालूँ, आप लोग कितना डालूँ?
देखिए 5 लीटर्स के अंदर जो हमारे पास जो है वाटर के साथ आता है 5 लीटर्स के अंदर, और इसके साथ एक पाउडर फॉर्म के अंदर इन्होंने एक पैकेट दिया होता है। आप 5 लीटर्स के अंदर उसको मिक्स कीजिए और उसको थोड़ी देर के लिए शेक करने के बाद 5 मिनट के लिए आप रखिए, उसके बाद आप कहीं पे भी जो है जब चाहे आप यूज़।
ये तो आप लोग मिसाल के तौर पे ना, आपके पास तो वर्कलोड ज़्यादा है ना,
जी जी
इसीलिए आप 5 लीटर्स बना लेते हैं।
जी जी।
राइट नाउ 100 ml का हमारे पास है।
देखिए मैं आपको ये बताऊं कि आपका स्कोप का जो है उसके केमिकल के अंदर जो है डिप होना बहुत ज़रूरी है, और हम लोग जो इस्तेमाल करते हैं हमारे पास जो है टब जो है उसके अंदर 30 लीटर्स आता है, ठीक है। हम लोग उसके अंदर 6 बॉटल्स को यूज़ करते हैं ताकि हमारा स्कोप जो है प्रॉपर तरीके से डिप हो और प्रॉपर तरीके से स्टेबलाइज हो, तो इसलिए स्कोप का उसके अंदर डिप होना बहुत ज़रूरी है। चाहे वो अगर आपके 20 लीटर्स के अंदर आ जाता है या 30 लीटर्स के अंदर आ जाता है, आप उसको डिप कीजिए, ठीक है।
अकरम भाई बहुत सीनियर
You want to do the feedback first?
Okay, we've come to the end of a marathon 4 days. Very tiring for everybody this side, and I'm sure everybody that side too. Even more tiring for those who have been working very hard to get everything organized. Before I thank people who I have to for whatever we have done in the last 4 days, I want to have a feedback from you all. We just you don't have to say it was good. We just want to know what you feel about the last 4 days that you've spent with us, whether it was beneficial or not so beneficial or whatever. So we'll pass on the mic. First the hands-on people, and then we also want to hear from the observers, please.
Hello, thank you. Basically, I congratulate you all and moderator and also housekeeping of this workshop. So basically, I improved my basic concepts of the ERCP. Since long, I was doing 3 to 4 years under supervision, but the things I have learned here I actually now mean the ERCP, how it occurs and different steps. So I will improve further by doing themselves at my center. Even I will make it more easier for my colleagues, and I will think clear and I will do read the things more so that I can further improve my these things. Thank you.
That's Dr. Nandlal.
Bismillahirrahmanirrahim. First of all, I'm thankful for all of you, the team, for giving this opportunity to us, all new comers in this field. And we have learned a lot from the basics. And seeing you people doing ERCPs, it's heartening for us. Someday we may be able to do like that. And this can be done. Previously, where we were trained, basically, we were shaky. Our teachers are not able to do, and how we can do that. But here we get the basic concepts, and there are minor, very minor, small things, but I think they matter a lot. And in our phase, we are in more hurry, but what we see in all the three, our trainers, that this is a very fine tuning. And these are very fine steps, very managed and controlled steps which are required basically. And again, it's always a pleasure to be here, and I'm thankful to all of you.
Thank you.
That was really great. And what I found the difference here that made it a very good thing is that the theoretical knowledge of all the steps was very well delivered. And previously, I mean, as Dr. Shahid has said, that what I have seen, that, for example, just see the ampulla, start banging on it, and one way or the other it goes, and if it does not go, why it went, and why in the other attempts it was not going, I was not knowing. And even some of my supervisors were not knowing. And they were saying that, okay, ERCP is just like this, that, just try and try. At times it goes, at times it doesn't. So here the minute concepts and the clear theoretical knowledge behind it, why it is not going, why it did go, was very well delivered.
Thank you, Dr. Abdullah.
Sir, it was very informative course. The difficulties which I was having there while performing ERCPs, these all are, I think, I have improved a lot in this session, as well as inshallah when I will go there. So the things which I have seen here from all my teachers, so inshallah I will work on those things. Inshallah in future I will improve a lot. So I am thankful to all my teachers. They are talking good.
Thank you, Dr. Saad. It was really a great opportunity for me to come here and to learn many more things. Like I am just new to ERCP, but the skills which were taught to me in my 4-month stay in Japan and then in a department over there in Peshawar, I think the ideas were not that clear. I still had so many confusions regarding the basics. I think many concepts of mine have been clear here, and at the end of this workshop, I understand many more things, how to do and how not to do, and which moment will take us which way. So I think I appreciate all of you, and it is really appreciable. And I hope that in future we may have such activities in other big cities of Pakistan, like the foreign faculty, Dr. Khalid Hassan and Dr. Waqar Saab. I think they should try to develop some more friends to make them realize that we really need their help in this country, because as we see that in a country with a population of 18 crore, this is a real pathetic situation. So I think that I request from this forum to you both that if possible you should try to contact more of the friends who are willing to come to Pakistan to develop this field of very technical and demanding skill. Thank you very much. Thank you all.
Thank you. Observers now. Doctor साहब observers के नाम please ज़रूर बता दें because hands on
Thank you
वाले
very
को तो
much.
मैं नाम
My name is Dr. Amir Iqbal. I am working as an associate professor in Liaquat University, Jamshoro. I'm thankful to all of you, especially Dr. Niaz, as well as the all the way the people came over here. Naturally, being an observer, a little bit hectic for us because you have to only observe the things. But it's very wonderful because previously Dr. Niaz also came to Jamshoro many years before. But like Doctor said, my even humble request is that you should focus even through this form as well, because this is a Pakistan for all, and is my humble request that other people want to get benefit from you as well. Number one. Number two, my suggestion is that if you modify, say for example, for observer, at least say for example, not might be the new batch will come, at least on the third day or the fourth day, they should be hands on the dummy as well. And instead of, say for example, you cannot, okay, go and take on the live one, but at least the dummy. Reason is that okay, they should get benefit a little bit. Reason is that if they not do on hand, the next, say for example, as you said, those people which have observed, they will be on priority on the hands on the next. If they've got some idea to how to handle, how to say for the cannulate, then it's better for them. Number one. And number second suggestion is that, say for example, in the state of the accessories, it is shown at the last, it should be on the first day. Reason is that the people become familiar to that. The balloon, what is the balloon? Say with the people, same, sometimes the people came a little bit new, they are not knowing and they are not familiar to that, say for the accessories as well. So this is my second suggestion. At least to engage the observer as well. They a little bit, you should think about it. What should be, because you are doing as well as the, say for example, those are hands-on, they are doing. Only the people which are observing.
We have two options. I'll just stop you there. We have two options. We stop observers and just have 5 hands-on, or we have observers. We can't give any hands-on beyond 5 people. 5 I think is still more. Ideally, like they're saying, 4 should be what it is, so that our focus is on those 4 or 5 people. We've had long debates about it in colonoscopy as well as previous courses. We've now done 5:6 courses, or I don't know how many, and 3 of these. So
no, it's okay, whatever you like, but this is my
what
suggestion.
I'm saying is that it's just not possible for us. That's why we put it very clearly. You're coming here to sit and see, even, not getting hand.
Even and not a whole day. Say for a session for the dummy. It's my suggestion. Might be you are the naturally tutor and you are the faculty.
What I think we can do, what I think we can do, and we'll discuss this maybe.
Naturally, whatever you like. This is my suggestion.
Half day ka kar sakte.
Thank you very much once again.
Ka suggestion is good and we'll work on it.
I am Dr. Hafidullah. Basically, I'm thankful to everyone that basically I have cleared my concept. They have given the good lectures, and initially I thought that during observership it's not necessary to attend the observership course, but after attending this course as an observer, I have learned a lot, and I taught techniques. I teach techniques how to play with the movements of the wheels and everything. But I learned a lot in this course basically.
Thank you.
I will make 2 points over here. Many thanks and appreciations have already been done. Number one is that I found that spatial orientation regarding the papilla, the biliary duct course, the pancreatic area, probably many of them were lacking in exact concept that where the bile duct will lead and what is the entry point and how the septum behaves and which way to stop. Number one. Number two is probably being the novice, everyone is in a hurry, but still the point should be made clear to them that it's a slow process, step by step, mental approach, and foresee before you just push and push and push. The other suggestion is probably that the material should be provided before the workshop at home, like 1 month or 7 days or 10 days or 5 days before. And it should also include a questionnaire so that you can assess the people from there, that what are their concepts and how they will behave in the workshop. Thank you.
Okay, thank you. Those two suggestions we'll work on. I'm sure material can be sent. That's not an issue. We used. I thought we were sending the material before, but that's in the colon course. Okay, so we can work on that. We do that for the colonoscopy course, and we can always do it for ERCP.
I'm Dr. Faisal Ziauddin, Associate Professor, Ziauddin University. And after my humble thanks to the faculty for their sincere attempt to deliver all which is possible in a short span of time, there is one thing for me, and I would like to share it with my junior colleagues also, is after especially listening to the, strict standards abroad, after 300 ERCPs, somebody is allowed to do an independent ERCP. In this city, even I have a lot of my seniors who have been, who started ERCP on their own, and after doing procedures 1, 2, 3, and so on, and they were on their way. I think that we all who were here should at least have some supervision, and when we are going for any, because there is a temptation to go independently, we should ask one question from ourselves: would I be doing the ARCP of my mother or of my father? If the answer is not, then I think there should be at least supervision, and once you have not 300, then at least 100, 150 cases, and then this would be more ethical.
That's a very valid point, and that's what I was taught by my mentor and my teacher, and he always told us this, that if you can't do something on your own, dear ones, do it under supervision. Supervision is fine, you can do it on anybody, as long as there's somebody to supervise.
My name is Dr. Prem. I am from the Hyderabad, and I am working as a senior instructor at the AIMS hospital with Dr. Sadiq. When Dr. Sajda called me, you are selected to an observer, I am slightly disappointed. What be observer? I should be on the hands-on. But when I came here and I see and I observe, it's much more beyond the expectation, what is observation, and I achieve my goals as well. And thanks to Dr. Saad, Khalid Niaz, and a broad faculty, Dr. Wakar and Dr. Khalid, and they did the nice program and workshop, and their discussion is so interactive. I want to one suggestion to give. This interactive, it should be more relative to in our course, like some scenarios and answers and questions. So it's much more beneficial regarding our course as well. And especially in the end, I thanks to Shahryar, Dr. Shahryar. Without this workshop cannot be put out. He's worked as a dual, as a organizer, as well as to control the audio visual effects and all these. These are the main position in this workshop. Thanks to Dr. Shahryar.
I'll make a comment on that, but not now. Let me proceed.
I am Dr. Shaista, working as Assistant Professor, Isra University Hospital. I am thankful to the committee for giving me an opportunity to came here as an observer and to attend this workshop. I found it very beneficial in improving my concepts of regarding maintaining the position of papilla and to pass the gastroesophageal junction especially. Many times in past I stuck up at the gastroesophageal junction and I didn't know how to overcome it. But in future I'll definitely overcome this issue of mine. Thank you to all.
Okay. Thank you, everybody. I sometimes feel maybe it's putting you on the spot is probably not worthwhile. That's why we've given you a form. I expect you're all going to say good things. I'm sure even if there were some things that you were not happy with, it's unlike Pakistanis. that we would actually stand up and say it on the face. So, but I appreciate all the good remarks you've made. On the other hand, I do want anything that, like you said, things that we can improve on. We're also learning. It's only our third course, and suggestions are always good. We are very happy to take criticism. We are human beings. We may have done something wrong, so it's nice if you can point that to us, so that next course maybe we don't do that. There's a lot of hard work that goes organizing this course. Some you have seen, most you have not. Starting from organizing, getting dates from the two colleagues there, organizing their schedule, setting up the dates, making sure that it fits everybody's schedule, to selecting the candidates. It's a difficult one. We had about 20-25 applicants, and to pick up 5 is not always very easy. So we would like to give everybody an opportunity to come in hands-on course, but we are limited. We are now, this year we'll be spending 10 days, full days on workshops. That's a lot. The selection of patients, which I'm sure my colleagues here would agree, we tried to avoid anybody that was really complex as much as we could. Getting stones, making it simple ampulas for you takes a lot of hard work, okay? And making sure they're all here. Okay, we worked on a day off. We worked on a national holiday. The whole team, everybody was here. The entire ward functioned when we were off officially. So there's a lot of hard work that goes, and a lot of people who are not actually noticed, who contribute almost equally as much as I do or anyone else. But the main pillars, the person who's behind the course, or the persons who are behind the course, are Dr. Sajda Qureshi and Dr. Shahryar. They are actually the ones who've organized all this difficult bit. My job is very easy. I just call Khalid and I call Waqar and I tell them, yeah, we need to have you here and give us a date, and that's about it. And then after that, organizing patients, organizing the list, organizing the candidates, everything is basically Sajda. And Shahryar then contributes with all the gadgets that we have in this unit, and of course organization. And they're both excellent teachers. I can tell you that. They're very good teachers. So there's a lot of hard work these two put in. So big applause for both of them, please.
It would be quite funny if he doesn't change the camera after 15 minutes.
Yeah, he's always bringing something new in the unit. I always forget the anesthetist. You have no idea how easy it is when you're doing it under propofol, and there's a lot of hard work put in by them. Are they here? They have left. They worked on a day off as well. So, thank you, anesthesia department, for making it easy for us. Our technicians, we are very proud of them. They are excellent. They're at par with any technicians, as far as I'm concerned, that I've seen work in the world. And they are, again, as I said, they are like backbone of our unit. They make it easy for us. They organize everything. Everything is ready. And so, thank you, all the technicians, everybody. Housekeeping, nursing staff, janitorial staff, making sure that the ward is clean, all those things are equally important. If this ward was dirty and we were doing these cases, these two sitting here would be unhappy. I don't know if they're still happy or not, but they would have been much more unhappy. There's some juniors who have contributed a lot, and I can't not take their name, because they were the ones who were taking the patient, bringing them, giving you history, making sure the list was on time, making sure everything was okay, labs were all done. Dr. Kiran, Dr. Numan, and Dr. Fahad, good job. And excellent work, excellent selection, excellent everything, all organization. We literally did not have any hiccup almost zero problem, alhamdulillah. Um, you know, it costs a lot of money to do these courses. These two here get nothing. I don't get anything. But still, despite of that, there's a lot of money that is required to do these courses. And we are very grateful to Getz Pharma, who have given us grant for all 3 of our courses, and which makes it very easy for us. Feroz Sons has also been very supportive to us, and they have also supported our courses. So thanks to Getz Pharma and Feroz Sons for supporting us. I'm more thankful to Getz, not because I like the company, but because they have no endoscopic interest. So this is a pharmaceutical company that has no interest in endoscopy or endoscopy accessories, whereas Feroz Sons obviously is Boston. So thank you, Getz and Feroz Sons. I don't want to miss out on the person who provides us regular tea and coffee every course, Mr. Zaidi and his group. Thank you very much. On behalf of all of us, I would like to thank all the patients who took the trouble of waiting, sometimes long hours, and waiting for their cases. I hope they benefited from it as much as we benefited. So in absence, I would like to thank all our patients. And who am I forgetting? Last but not the least, those of you, huh? Who? Oh, you can mention him, I'm not mentioning it. I think thank you all for taking time out, coming, and we enjoyed it. And obviously if you were not here, we would not enjoy each other as much, seeing each other do endoscopy or ERCPs or whatever, but your presence obviously was very enjoyable. Trust me, whether believe it or not, every course there is something I learn. And I love that about every course, whether it's colon, ERCP or whatever. I learn, and I want to keep learning, because the day I stop learning should be the last day of my working. So thank you very much, hands-on and observers. Now, I'd like to thank Waqar, who is actually part of Surgical 4 endoscopy facility. And we now have international faculty on our, not on our payroll, but on our roll register. Waqar always has obliged us by never saying no. It was a dream that we both had, and it's really, really very heartening to see this continuing and to see it the way it has continued. Very proud of him, and lots of regards, and I hold him very high in my heart, and thank you so much, Waqar. We now have a new member of on our roll, and by the way, now 2 comments. There's a comment that came that Pakistan needs other cities needs. These 2 are taken. Find other people, please. And they're not going anywhere. Okay. Rights of their practice in Pakistan has been completely, totally taken by Surgical 4. I can give you other names who I'm sure may be inspired by what we do, and they can set it up. Okay, I don't have a problem them going, but I wouldn't want them to miss out on our thing. I think one of the points that you were making, Dr. Saab, it's very important to have a facility. We don't realize, obviously you come from good units and some relatively less advanced units. You need to have certain basic facilities within your infrastructure is very important. And I think that's what we have, the patient volume and everything else is very important. You want to do something, you want to do it at par with whatever else is being done in the world, as much as you can with our certain limitations with the logistics, etc. So, Khalid, you are part of our unit. Thank you so much for coming from Florida. How long was your flight, Khalid?
17 hours. 18
okay, 18 hours. That's 2 days of ERCP is gone. So thank you so much. You both left your families, came here to Karachi. With all the bad press we have, the killings of doctors and everything else, they came. It is really, really, I'm really thankful. Okay, I think I'm done with thanking people. If I have missed anybody out, sorry. Over to Sajda so that we can continue with this. Please give us the feedback form. And if you have already, if there's something you remember that you want us to improve, please put that. Thank you.
Thank you, Dr. Saad. So now we come on to the much awaited certificate distribution thing. Is Waqar here?
By the way, I think because we are part of PSG, these certificates will help you in your registration. Now the PMDC new regulation, you need to have certain points, credit points, and if I'm not wrong, PSG is part of that, and by virtue of that, you should get some credits for when you pull out. So just check it with the PMDC, and we will also let you know.
Okay. So. Okay, may I now request our faculty members to please come here for the certificate distribution? Dr. Waqar, Dr. Khalid, Dr. Saad. So we'll start with the hands-on candidates. Dr. Nandlal. Dr. Farooq Zarkoon.
Farooq is also a regular at our He's a regular.
Dr. Shahid Rasool. Dr. Abdullah Khalid. Dr. Kamran Hassan. Now the observers, Dr. Shaista Zaid. Dr. Amir Iqbal Memon. Dr. Prem Kumar. Dr. Amir Salim. Dr. Hafizullah Sheikh. Dr. Faisal Ziauddin. Now our technical staff, Mr. Akram Rahmat. Mohammad Wasim. Zubair Ali. Eric James.
Eric ने थोड़ा बहुत काम किया था। Eric incubation में अच्छा था।
Zakir Ali. Reema Parvez.
ये लोन वॉरियर है हमारी।
ये छुट्टी रहती है।
Zubair Ahmed.
ये हीरो है।
Staff Rabia. She's gone, okay. Habib. Anthony.
Anthony has kept everything clean.
Anthony is the ज़्यादा काम।
हाँ, Anthony ने ज़बरदस्त काम किया। Well done.
Prem. Lakshmi.
Well done.
Mohammad Baksh. Is endo technician. Endo what by rather, not technician. Sagir. Now we've got the main person, Muhammad Waqar Khan, the main person behind all the arrangements. Now our volunteers, Dr. Muhammad Ali Taj. He's also the coordinator. So you're getting a double one, Ali, for the coordinator as well as the volunteer.
And food advisory service.
नहीं इसमें नहीं था। अच्छा, lots of people did not eat maybe because of him. Yeah. So Talha Saad Niaz. Talha was a big help to me. Thank you from my side personally.
साइदा की जोड़े सुनिए।
Dr. Kiran. Fahad Hanif. Dr. Noman Mehman. Noman Paul. A special thanks to all three of you, Kiran, Fahad, Noman. And I'm sorry if I shouted at you.
It will happen again.
Yeah. I'm sure you people are used to it by now. So now we come on to our sponsors. Khabar from Feroz Sons. Mr. Zaidi, BNN, Mediline. And last but not the least, Farhan gets Pharma. Now may I request Dr. Saad Niaz to present a moment of thanks to Dr. Muhammad Khalid Hassan. Dr. Bakar Ahmed. Now I'm going to request myself to present this moment of gratitude to Dr. Saad Khalid Niaz. I'm sorry, Shahryar, nothing for you to give. Which you're not going to get, I'm sorry. Okay, that's it. Thank you, everyone. Thanks a lot.
Where are yours? How can? So I'm also part of the ward. Why did you give it to me?
I told him he's going to get an extra accessory.
No, that's absolutely unacceptable. So what I'm going to do is, I'm going to divide both of you. And not possible. You both have to take it, but they can always make another one for me.
So it's all right.
No, it's not all right. We do not have
As both of you come.
both of you come.
You better make two and leave it to yourself. Photos kar lete, but like, is there anything else you need to? That's it? We're done? Okay, great.